the National Institutes of Health, and the U.S. Agency for International Development to help us to understand where we.
First, we are quite literally discovering more about Zika every single day. We're working around the clock to find out as much as we can, as quickly as we can, to inform the public and to do everything that we can do to reduce the risk to pregnant women.
Centers for Disease Control and Prevention since June of 2009 and has dedicated his career to fighting.
Right now, the most important thing for Americans to know is this. If you're pregnant, we recommend you not go to a place where Zika is spreading. And if you're pregnant and you live in an area where Zika is spreading, do everything you can to protect yourself against mosquito bites.
And reduce multi-drug resistant cases by 80% and worked in.
Aedes aegypti mosquito is a very challenging, what we call disease vector to control. It's an indoor biter. It bites all through the day, including at dawn and dusk. It hides in closets and under tables and places that are hard to get to. Its larvae or eggs, its eggs can be drought resistant and can persist for some time. 5 people in the course of one blood meal, meaning it can spread disease quite quickly. We will likely see significant numbers of cases in Puerto Rico and other U.S. territories where there may be intensive spread of Zika.
Thank you, Chairman Smith, Chairman Duncan, Ranking Member Series.
The thing that we may see happen is cases or clusters in part of the U.S. that have had dengue clusters in the past. That's why we need support for local mosquito surveillance and control measures. We may also see sporadic cases elsewhere in the U.S., and of course, unfortunately, continued spread around the world.
Changes in global travel and the like. Ecological transformation.
To do these investigations and to do the response, we will need additional resources. Vector control is complex and expensive. There are a series of measures we can take, particularly in the U.S. area of Puerto Rico and other parts that have had dengue transmission. And we look forward to working with you to inform people about the latest information on Zika and what we can do to stop it.
Mandate is to provide the basic understanding of disease, the clinical research,